Elliot in a Take Your MPP visit. You can see part of the video already posted in our website. And we were at Michael Garron Hospital. And Kathleen, just so you know, we did thank everybody across the entire OHT. So you need to know that. And mention Riverdale in particular also, because the work has been amazing. And then in the afternoon, we had a visit with MPP, NDP MPP in Kingston, Ian. It was fantastic again with the Kingston Public Health Unit. I don't know if anybody from Kingston is here. We are at 180, just so you know, Susan. And what's wonderful about Kingston is that they have had zero cases in nursing homes, zero deaths, of course, then, and very few cases even in other places. And the reason being, you can all guess, lockdown very quickly, PPE very quickly, testing in huge rates and surveillance testing, etc. They have done fantastic work, so really amazing. So we had a visit with many of the nurses and their programs, and Ian had fantastic questions for them. Tomorrow at 10 a.m., I hope that many of you will be able to join us for the release of ECHO 3.0. And if it is any indication, we already have 6 media interviews booked. And I believe we hit the nail this time. Shirley, you will be happy. I believe we hit the nail. I think the province will follow our request of all of them. You will see 9 recommendations, that's all. And you will see 4 transition recommendations. Kathleen, if I can say to you also, you will love it. I strongly recommend that you attend. It's worth coming. And then at 2 p.m., we are awarding 3 tremendous nurses, 1 RN, 1 NP, and 1 RPN. And that is jointly with RNAO, we RPNs, and ONA. And we have 2 guest speakers. One is Lord Nigel Crisp, who is the co-founder and co-chair of Nursing Now International. And he will bring remarks about the role of nurses. He was a high official in NHS at the time. Since then, he has become Lord. And we also have a very, very interesting and very thoughtful and very well-spoken and well read and he has written a lot about policy and about the role of nurses in particular to ensuring health for all. And the closing speaker is Minister Elliot. And then in between, you will see 3 remarkable people that are receiving the awards. Angela will present for the nurse practitioner. Ona will present for the RN, RPNO for the RPN. And I want to thank Heather, who I hope is here now, for leading us through that tremendous work and the selection of 3 people amongst 240 something applicants that I understand from Heather, all of them were outstanding. On May 14, we have an event that is for employers as well as for job seekers. And what we will do then is to share with people that our work on RN careers, which is the usual job posting that RNAO has. Be a Nurse was only a COVID initiative. And also we will inform people that while we will continue with the Be a Nurse, it will be only for organizations in outbreak, because people are starting to use it a lot for their regular job-seeking people, and that's never was the intent. So we will inform people that go forward next week. We are starting to use the careers back for people that need positions to be filled in general, and that the VNRs will continue, but only for outbreaks. So that's the first part of the session that will be from 2 to 3. And the second part will be for people that are seeking employment. And we always have very good tips, and we also have where to post the resumes, et cetera, et cetera, et cetera. On Friday, May 15, we will close Nursing Week with the release of the second edition of Oral Health. And it is just thrilling that that's the VPG that is being released because of all that we have seen in nursing homes. So it's just good to be able to celebrate nursing homes with something that is really for them. So this is the Nursing Week portal. Please visit the portal. For the event tomorrow at 10, you do need to register. Of course, it's free of charge, but you do need to register. Similarly, for the Nursing Now Awards, you do need to register. And also for the RN careers, you need to register. Same as you register today, nothing complicated. So that's the overview, and let me ask Angelina, as I call her, my awesome and beautiful president, to bring a few remarks to nurses and others that support and work with nurses and help us shine all together on Nursing Week celebration. Angela, please.
Thank you very much, Doris. And I just want to say happy Nursing Week to all our RNs, NPs, nursing students, and RPNs. And you have done excellent work during COVID-19. You are heroic in your approaches, diligent, compassionate, caring people. And in Nursing Week, we celebrate who you are. So I'm saying who you are. You're selfless, you're diligent, you're competent, you are so gracious in caring for patients. And I want to say what you've done. You've done excellent work, very diligent, using your knowledge, skills, and abilities to care for the people of Ontario in every sector of healthcare. And for those of you who are working in long-term care, I say kudos to you, those of you in the ICU. And now I'm going to get myself into trouble because I start to list names. So I say on behalf of all the nurses, I thank you for what you have done, not only during COVID, but throughout all the years in your career. And this is the year of the nurse. So give yourself a pat on the back, celebrate Nursing Week, and make sure that somebody bring you bouquets. I should tell you, yesterday, my next door neighbor called me and said, I was still in my PJs, Angela, come downstairs. One of my former students, who is a young RN, sent me a bouquet of flowers, and her mother dropped it at my doorstep. Today, another nurse called me to tell me I am her nurse for the year. So I feel really puffed up by my peers, by my colleagues. And I want again to say thank you, a special thank you for all you have done and what you continue to do throughout nursing. It's an excellent profession, and you have raised not only the profile, but COVID has raised the profile of the nurse in 2020. And for that, I say thank you. I know we've always done good work, but it shined a light on the healthcare system and nurses' contribution to it. So kudos to you. God bless you and enjoy the rest of the week. Thank you.
Thank you, Angela. And before we get going, Susan, and it pains me when I do this, but I do think we need to do it. In the midst of this celebration, we have been lucky in Canada that we have not lost nurses, that we have lost though many, many, many lives of people, many, almost 5,000, if not 5,000 now, and 7 health professionals, of which 6 are PSWs, personal support workers. And so our hearts go to them and to their families for lives lost. And in around the world, many of our BPSOs and other places, we have lost lots of nurses, guys, lots and lots. So while in Ontario, Canada, we have not, and I hope we will not, we still have lost lives that as we celebrate Nursing Week, let's keep them here so they are with us in the celebration. All yours, Susan.
Well, Doris, I just wanted to quickly provide a bit of background for our guest speakers today, because we have a full panel, 5 individuals on the line with us to share their experiences of shining during COVID-19. They all participate in RNAO's Best Practice Spotlight Organization program, specifically designed for Ontario health teams for integrated systems of care. And the goal is to optimize people's outcomes through evidence-based practice and robust staff engagement within organizations and across sectors. And today we have 4 teams presenting. We have, we're going to be hearing first from Ottawa East Health team, and then East Toronto Health Partners, South Lake Community, Northwestern. So those are the 4 groups of BPSO OHTs that we're going to hear from. And here is our panel right on the screen. And I think many of you can see their pictures also live. But we have Esther Mogadam from Ottawa Public Health. She's the Director of Health Promotion and the Chief Nursing Officer. We have Kathleen Foley. She's the Director of Quality Improvement and Evaluation at South Riverdale Community Health Center. Shirley Sharkey is the President and CEO of SE Health. Tracy Comeo, who's the Executive Director of Villa Colombo Home for the Aged, and Irene Andress, the VP of Patient Experience, Health Professions, and the Chief Nursing Executive at Michael Garron Hospital. We're so delighted that all of you could come and share your experience of what COVID meant for your teams and how you demonstrated knowledge and courage during this pandemic. And I'm going to advance the slides for Esther as she speaks, but we're going to start with Esther and welcome you, Esther, to present what you'd like to share to the group.
And Susan, we are taping, right? So we can post?
Yes, we are always taping. Yep, so we're good to go.
Well, thank you very much, Susan, for that introduction, and what a distinguished panel. I'm so thrilled to be a part of it, so thrilled to be bringing the public health voice, and even more thrilled to be talking about our experience with Via Nurse. We were the first organization to implement Via Nurse. I can't say enough about it, although you're keeping me to 5 minutes. So I have some additional
I know,
details.
I'm sorry, I should apologize. I did say to Susan, you get 10.
Thank you.
In fact, Susan doesn't know that I told many others they get 7.
Yeah.
So I'll aim to be a bit of the police to keep us on time. And what I'm going to suggest is that people go ahead and ask questions in the chat box. I'd like to suggest that we do answer the questions at the end after everyone's had a chance to present.
Okay. So this is a story about Via Nurse at Ottawa Public Health, and this is really the story about the Via nurses that were part of this journey. And I really want to shout out to them. I know many of them are joining us this evening, and look forward to their ongoing comments. So for us and for you tonight, it really is about sharing what we are seeing as the benefits, some of the challenges, and some lessons learned. So Susan, can you pull me up to the first slide? A huge thank you to the RNAO for your response in what I can only say was a moment of crisis. And again, thank you to the Via nurses who came into our organization with open minds, an open heart, and open arms, and have been providing me with reflections on their experience. I came into COVID when it was the perfect storm. We had stood up our incident management system in January. I was only a part of it after the first case arrived in Ottawa on March 11th. I was put into the role of the planning chief on March 13th. You'll remember that day, RNAO, Susan and Doris, that was the day that you received the call from me, because I was confronted with 2 challenges. One, I was asked to build capacity urgently. We were getting 2,000 calls a day from Ottawa residents who needed to be triaged and were also calling us in the early days for their laboratory results before, of course, they went online. More importantly, I had to build scenario for case management and contact tracing with a 3-day doubling period that in 2 weeks was going to take us to a scenario of 800 cases a day. Oh, sorry, 800 cases a week. We had 6 FTEs, six to deal with COVID. At Ottawa Public Health, maybe like other organizations, it takes 6 to 8 weeks to onboard one person. It's a very formal process. We had to do something different. So as you can see, within 3 days after the call to RNAO, we had, and in fact, within 12 hours, we had responses. Within 3 days, we had 40 registered nurses and nurse practitioners that had come forward. They were trained, they were ready, and in less than 2 weeks, we had 100. Right now, we have 63 on our roster. I can't tell you enough the impact that this has made. I think kudos to Kingston. They've done an incredible job, but kudos for Ottawa for probably having the highest, if not maybe one of the highest rates of being able to reach contacts of cases within 24 hours. We're achieving about 98%. But most importantly, you know, what was the experience like for VIA nurses coming into our organization? We need to find out. It's an excellent model. We want to keep it going, but that just maybe go to the next slide. Susan, if you can advance to the next slide. What I did is I went to a resource that it's a framework that I use, Hardwiring Excellence. It's an outstanding practice-based framework that inspires has inspires me to think strategically and tactically in terms of how to build engaging and positive employee relationships with passion and with care. So there are 5 questions from Hardwiring Excellence that I put out to our VIA nurses at Ottawa Public Health. This is the first question, and I can only summarize the response. With Ruben's painting, which is Daniel in the lion's den. It was a positive response for the majority of respondents, but it was stressful. Many of them said it really was truly like being thrown into a lion's den. The next slide. So Hardwiring Excellence, of course, tells you, ask people what's going well. One of the things I need to stress is what VIA nurses brought to our organization. We put in a number. This is a workplace. We wanted we wanted the environment to be safe for our employees, for our nurses who were working fairly close to each other. So as you can see, this is a hallway. We had some lane markings. It was our VIA nurse that said, how about you make this one way? They shared what they had done in their organization, and what they did is they brought some best practices that we could use. And I can't say enough about the knowledge exchange that we were able to, in a reciprocal way, work with each other. The next question that we need to ask is, thinking about other work locations, what are some things in place there that you feel could make us better? And what they told us is that this is a word cloud from some of the responses. And they're telling us this model will work everyone said, in any other organization. But you need to keep your eye on quality. And that's the, can you hear me?
Yep.
Okay, because I've just lost my audio, and I thought I lost my video as well. So on the next slide, which is there anything here that you are uncomfortable with? Anything that might cause you to want to leave? So the majority had no concerns, but a few noted that it was bumpy. It was bumpy for many. No one sugarcoated their feedback. everyone is being very gentle in telling us what their experience was like, and it definitely revealed some challenges. Management, they said is at times was unresponsive to feedback. They perceived some favoritism by management in scheduling. So this is some very important feedback that we're taking away and reflecting on. On the next slide, E, what advice do you have for other healthcare organizations that may need to rapidly recruit through the RNAO via nurse program? They again had some positive things to say. They did caution us to potential risk of overhiring. They also cautioned us to practice models that bringing VIA nurses from so many different cultures and so many other organizations can be a challenge. That diversity, where some perhaps people in practice setting operate or work maybe perhaps more independently or autonomously than other organizations, is an important consideration. And then just lastly, here are some of the lessons learned. And I just need to say that, start up by saying VIA Nurse is an extraordinary recruitment tool and model. The VIA Nurse RNs they're a talented skill mix. They're knowledgeable, committed, adaptable, motivated. Their baseline knowledge was exceptional, which they felt was really due to so much to the RNAO daily updates and briefings that they were given. And then I think the last lesson learned that I want to highlight before I turn it back over to you, Susan, is that managers receiving VIA nurses, we must practice humility. We can really learn from VIA nurses. I think what this has created for us is a new network of collaboration that brings nurses not just together to create value, but to create new sources of value. And I'll stop there.
That's great.
Thank you so much, Esther. That was really interesting. And I'm going to turn it right over to Kathleen now. So Kathleen, you can unmute. Great.
Yeah, I've unmuted. I just have a very noisy cat in the background, so if you hear it, they're running fad. That was somebody else's job downstairs, but they didn't clearly get the memo. Thank you for inviting me. I feel quite privileged to be here and speaking with everybody. As I said earlier on when I joined the conversation, not being a nurse by profession, but working alongside nurses, it's something that I have the privilege every day in my job doing, and it's something I'm continually learning from and have a deep, deep appreciation for the profession. So quickly, came here to talk a little bit about the work that South Riverdale is doing, but also with the work that we're doing within the context of our OHT work in downtown East Toronto. So we're an organization where we have 99 points of access to services, 6 sites, and over 200 staff. And I think, when you talk about courage, compassion, and knowledge, I think that one of the key things that we've been challenged to do is have the courage to change and the courage to re-engineer, keep the client at the center of that, and then always think about, and I think, Esther, listening to you talk about how we collectively share what we've learned over the last couple of weeks to help us as we move forward, particularly because this isn't over and we've got a lot of work still to do. So how we take that and how we take some of that learning and move it forward in terms of the work we do with clients and community. So at South Riverdale right now, we have 200 staff, but we've now got only about 69 folks who work on site as providing services. Everybody else has kind of moved off site and doing work virtually. The work, though, that we're doing that is considered essential services, particularly related to harm reduction programming. And I think that what we've learned in terms of our reflections is that, we need to still continually working tirelessly to collaborate to deliver services. This is about working together across a partnership. We can't do this by ourselves. We can't do it by ourselves. We can't do it on our own. And we're stretched. But those partnerships are making us stronger, I think. And I actually think that it'll take us now, because we need those partnerships to dig deep in terms of the work that we're doing with the marginalized communities that we're working with over the next little while. So the work that's been done over the last couple of weeks and months will keep us going through into the fall. we've continued to deepen our strategic partnerships across the OHT, and we're beginning to see the amazing thing in this space is we've been freed up to look at innovation. We've been freed up to kind of try things differently, and we've been freed up to kind of make little mistakes, but to make improvements and gains for client services. And I think for us at the center of this is the need to continue to advocate for inclusion, health equity, and social justice. I think that it's those who are most marginalized that we need to really work with. So this is a picture. This is a picture of our staff in Moss Park, which is one of our community treatment services in downtown Toronto. And we were called on to totally physically re-engineer the site. And if you can see in the second photograph, all that duct tape behind there, that's us looking at how we had to re-engineer the booths that individuals go into when they're using when they're injecting drugs, so that they could inject drugs, and if they had an overdose and we needed to do CPR, that we could do it safely without because it is an aerosolizing procedure, but at least we could do it safely without contaminating the space. That was done in a weekend of people sitting there trying to kind of figure out how to do things. The other work that we're doing that I wanted to talk about, where our nurses are involved in, is looking at how we work with shelters, respite centres, and group homes across the East End of Toronto. There's been a lot of attention paid to what's going on in long-term care, but we also need to kind of pay attention to what's happening with people who are living in our shelters and group homes and other respite centres. So we've been working collectively in the OHT, working with the team at Michael Garron Hospital, the infectious disease team, in particular Jeff Powis, to look at working with our community partners across the OHT, sorry, the cats are making an awful lot of noise, around how we can support them in terms of figuring out what's happening in their environment, how we can support them to procure personal protective equipment, and how we promote and support the frontline staff around how to use PPE, and then how we work with them in terms of that client journey. If somebody is assessed with COVID, how we support everybody. And that's been a team effort, taking in folks from the hospital, folks from our nursing staff who are doing the assessments, and our community partners who are also helping us with that. I also feel strongly that this is going to help us set a baseline for the work that we need to do into the fall. I leave you with some questions though. If we look at the next slide. A big part of our work is at the intersection of health and community. And so what we're needing to do now desperately is to look at what does that mean for us? What does that mean for those group-based programs where we brought people together to dance, to garden, to share food together? What and how will we re-engineer that space? And I think there's a lot of folks across the province right now who are working really hard to try and figure that out. Big part we see as a barrier to that is access to technology for a lot of the folks that we work with. And so one of the things that we are doing, and I'm not going to go through the rest of the slides, Susan, I'll leave it at this point, but I'll leave the resources for folks. But we're working on a device drive to see if we can get donations for phones. And we're also starting to work with community partners around kind of getting the word out in the community and doing some knowledge exchange pieces with our university partners. So how does the work in this space, how are we making change? How are we protecting people? And how are we working, what are the impacts of our collaborative work in terms of supporting community? So I will leave that as a resource for folks who want to find out more about the work that's been done with the opioid crisis and where we're looking to do some knowledge development. Thank you.
Great, thank you so much, Kathleen. So those slides, the rest of the slides will be there, and all of our slides will go on the website for further review afterwards. So now I welcome you, Shirley.
Thanks very much. You can see one of the biggest outcomes from COVID is our hair length and our hair color. So you can see from the picture and the color how life has been playing out. But I wanted to start with two simple words, thank you. And they have such huge meaning for all that nurses are doing at this time, in particular with Nursing Week, but in this pandemic. So thank you. Thank you from the bottom of my heart. For many years, I've been at SE Health now, 28 years. But I need to tell you that the last 8 weeks has, in fact, illuminated to me the power of people. And in particular, the strength, the passion, and the resilience of nurses is what I have seen. It has been a range of emotions, from initially shock to fear, to exhaustion, to gratitude and pride. Everywhere when I see our Journey Home Hospice, which is for palliative care for the homeless population and where our nurses play such a vital role, to the nurses making home care visits, and to many of the nurses who have taken on the task to be redeployed into the long-term care facilities. As I say, thank you is such a simple word, but it really means everything, because they are all heroes at this moment in time.
Susan, put Shirley on the video. We don't see Shirley.
You don't?
Susan?
I can see Shirley. I think it might be just the display, Doris, for you, so you can.
No, it's also Angela and many others.
No, I can see Shirley.
I can
see Shirley.
Good.
Yep.
Who wrote? Okay, good. That's good.
Can you hear me all right? Yeah.
Yes, we can hear you, but we want to see you.
Okay, all right.
Okay, good.
So what really is key has been information and communication at critical levels in the entire healthcare system, as organizations, and in, most importantly for our frontline staff, for our nursing staff. And I speak to this issue as a CEO, where it's really important to be honest. And I have to give Doris the most amazing shout out, because Doris is honest and she speaks to the issues from all perspectives, so that we can really deal with what are the gaps and what are the challenges, also what are the benefits to move forward. And honesty is critical if we actually are not only going to get through this pandemic, but many other challenges in the future. So you are an amazing leader, and I thank you for that, Doris. In particular,
and thank you for being there for me anytime I need it.
Wow. The last first couple of weeks, when home care was desperate for PPE supplies, and I mean desperate to the point, the expression, what keeps you up at night? It truly was keeping me up at night, because it was very hard to have home care be recognized for a need to have PPE. Where our staff, I was very nervous. Were they going to have enough supplies if they moved into a situation? And the first person that I spoke to and really understood the predicament we were in was Doris, and who really helped get that issue on what I would call many political tables, to help us be recognized that no matter where a nurse is practicing, if there's a need for PPE, it needs to be prioritized in all areas of our healthcare system. I think additionally, a couple of other challenges we've had is a real understanding of the importance of home care in a pandemic. And that if we don't provide not only services to COVID positive people in their home, which is the safest place now for people to receive care, in addition to ensuring that people continue to have the kinds of home care services they need, we're going to do just what we've been trying to do, which is prevent people from going to the hospital and emergency rooms in an unnecessary way, and to make sure that they can experience their life and their health conditions in the home environment. But ironically, a lot of our volumes have reduced. And so there's a real need, I think, to begin to turn the page and realize how important it is for people to continue to have access to care. Not that hospitals and other areas aren't critically important, but primary care, home care, and the community are going to be what brings us through this 12 to 18 month journey that we're in. And I think that that's sort of a critical lesson of what we've learned that hasn't worked very well to how we can move forward. What has been pretty amazing for me has been the use of technology, in the sense that we immediately worked and moved into what is called Teams, where here we're on Zoom. But what has been a privilege is I've been able to actually reach out to well over 500 frontline staff and go to the team meetings, which before there were the logistics of travel and physically being there. And Nancy Lefebvre and I, our chief clinical exec, and myself have been listening and talking to the very people at the direct interaction of patient care, and to understand, what are we doing well? What can we improve? How do we help you with your fear? How do we help with the client and family's fear? How can we improve the kind of information that we're providing? All of those kinds of things that suddenly demystify how we sometimes communicate and bring you right to where the source is to improve things. So I've been very delighted to actually see all of the team meetings, see our staff talking, though it's virtually, and where we can literally reach out and touch people and what the issues are and what's happening. Sort of the four things where I feel there have been some key insights are care comes first. And we know with nursing, it is all about care. We know that the BPGs have helped us understand the context for care and help legitimize how we can really provide the greatest outcomes based on those guidelines and what makes sense. And we, I think in this particular pandemic, have been able to move mountains because of that whole theoretical construct that has existed over many, many years. The need to feel safe. It's critical, I think, for us as nurses, where we need to definitely feel safe for ourselves, for our families, and to make sure society feels safe. Our patients, our families, our clients. In particular, people, and this is a real call, end-of-life care. It is breaking my heart where people are dying without their loved ones. And we can ensure that that can take place in a peaceful environment, in their home environment. And I really hope that's a big lesson we can learn in the next 12 to 18 months. No one should be dying in a place where they can't have their loved ones with them. We can figure out new models that will allow people to die in their homes with their loved ones with them. And if there's anything probably more on a personal level that's so important to me, it's that. Because just as life is so important at the beginning, our end of life is such an amazing phenomena for the respect that we have for people. And nurses are the key pillar to make that happen. Agility, and I think that we've heard from everyone, we'll continue to hear how important it is to change what we're doing. This is a great opportunity. But lastly, and most importantly, and this is why I'm very proud to be an RNAO member and to have been a past president with Doris, is the authenticity of making it real and speaking to what the issues really are and representing really nurses, yes, but representing society, the vulnerable, elder population, and everyone. And really, I hope that this is going to be a great opportunity to move us actually beyond our understanding of healthcare. Because nurses are all about life care for people. And I think that this is going to be a great opportunity for us to move into a very different beginning point in both primary care, in the community, in home care, in places where people live and enjoy life, and providing them with that nursing experience so that they can thrive and remain there. So I'll just leave you with, we're close to Mother's Day. My mother's not here anymore, but she always had this wonderful little thing for me when I was in a state of crisis, probably because my jeans had a hole in them or some silly thing. And it was always, Shirley, this too shall pass. And she also said, remember, rainbows follow the storm. So for all mothers out there, we're going to listen to them. She was always helpful for me. Thank you very much.
Lovely. Thank you so much, Shirley. And there are beautiful comments in the chat box for all of you who are presenting, so you might want to peruse that. Really well appreciated, Shirley. Thank you so much. So pass things on to you, Tracy.
Hi, everyone. A happy Nursing Week. to all of you. I've never been more proud to be a nurse, and I'm proud to represent long-term care, and I'm also proud to be back in uniform, helping where I can in my own organization.
Including on the weekend on a night shift.
Yes, I take that.
I do need to say that because Tracy, it was awesome. It reminded me when Esther called me. I remember Esther, the first day that we just had lunch via nurse, and boom, she calls. And then you called me, was a Friday night.
Yes, it was.
And like here, she was doing shift work because she couldn't find a nurse because some of the PSWs had left on the spot when she said they needed to go to patients that were COVID positive. And we activated via nurse right away. And all I could do is the next day to call and say, I hope you're not on a night shift again, are you?
The next day was my birthday. I got the day off.
Oh, I didn't know that piece. Here you go.
Tracy, just before you resume, I think that there might be some anxious people who are on the line realizing that it's 7:27, who are devoted, you know, they're doing the 7:30 cheer. So what we're going to do is we're going to do the cheer at the end of this call.
Yes,
and so we're going to continue. And
but it is inspiring, Susan, that they're calling us to the task at 7:30.
That is, it's wonderful. It's wonderful. Yeah.
My own street does that. I call it the Rosemount Avenue Band. Every night for all of these weeks, the entire street is out doing that. Makes me very proud. I just wanted to provide a firsthand account of COVID-19 and long-term care and our experience at Villa Colombo. We provide long-term residential care to 395 residents and over 750 community service clients. And we have close to 600 staff members at Villa Colombo between community and long-term care. So the story of COVID-19 at Villa Colombo, Toronto started prior to the March 11th pandemic being declared. Villa had been experiencing an outbreak of influenza B in late January and early February. And at the same time, we were listening to world reports of the coronavirus, particularly what was happening in China, and specifically important to Villa Colombo was what was happening in Italy. It was at this time that the leadership team, under the influence of our clinical educator, Lorraine Dunn, began to prepare for what could potentially become a worldwide pandemic, and in fact did. And Lorraine, I will say, as our clinical educator, was given a very hard time by families, by staff, by management, telling her that she was overreacting, and she had all of her ducks in a row. She knew what was going to happen. Lorraine was adamant that we should consider early active screening by mid-February. We now feel that this was the first step in prevention and heightened awareness, as well as pandemic planning and procurement of supplies early on. So in fact, if we go back to the beginning of this story, you'll see the groundwork for our pandemic planning was laid out solid, not only in emergency planning and infection control practices, but in best practice guidelines of person and family-centered care and care transitions. Resident council and family council were made fully aware, informed, and kept abreast of what was happening globally and what was happening at Villa Colombo. And in hindsight, we now realize that residents and families should be the major contributors to the overall pandemic planning for long-term care. That might have had more leverage of support in the early days when the doors were closed to families and private companions, but none of us could possibly grasp the magnitude and impact that this virus was going to have on the world, and certainly not in long-term care. So beyond screening, PPE procurement, minimum staffing requirements, schedules, communication, and advanced care planning became our two major focuses. We initially were assisting hospitals to decant residents that were waiting placement, and we had 22 admissions in 20 days until the admission process stopped. And that was a phenomenal amount of admissions for us. By the end of March, it was clear of the devastation that was hitting long-term care homes, and families were already asking how we'd provide care for their loved ones. Would they be able to go to the hospital? Would they be eligible for a ventilator? The media was raising anxiety levels for families and staff, and stories of seniors dying alone in homes throughout the world. Villa Colombo became very proactive and chose to speak with families and residents about care transitions should they become positive, and also worked closely with the Temi Lettner Palliative Care Unit at Mount Sinai Hospital and Dr. Goldman to ensure we had appropriate order sets ready and in place for end-of-life care should it be required. All medications were obtained from pharmacy, and advanced care directives were in place for our residents. A full isolation unit was established and fully equipped on the ground floor, totally away from the rest of the home area. It was important teaching for the staff who had to be prepared for end-of-life care that could be very different from COVID-19 than any other deaths that we were used to experiencing. A COVID-19 team was established, and with help from RNAO via nurse, we were able to fully staff the unit with the appropriate complement of nurses, and they have been absolutely wonderful, a great support, and they embraced geriatrics and the care that was required with open arms. Communication with families became paramount, and we needed to let them lead the way, tell us how they wanted us to communicate with them. In the beginning, it was easy because we didn't have any outbreak, and everyone was very interested in window visits. But when outbreak happened, those were eliminated. None of our home areas are actually on the ground floor. They start on the second floor. We needed to ensure we could show families their loved ones were being cared for, and it was especially important for us to gain their trust and make them feel at ease, if this was even possible. We developed a system to book video chats as often as possible, but remember, we have almost 400 beds here, and most of these residents have several children, and with staffing challenges, it could present quite a problem. So we hired 30 new positions, which were called resident service attendants, and they're on all of the units, on all of the shifts, and they're able to help with communication. They are not a PSW. They had been some previous private companions that were here, some previous volunteers, and we hired them. We started town hall Zoom webinars, which was a family request, and all questions and answers are provided on the website as well as regular updates every 3 days. Families had wanted more, but we decided early on that we wouldn't commit to doing more than every 3 days because things were chaotic in the beginning, and we wanted to make sure that we didn't set ourselves up for failure with that. Families wanted to know the numbers, they needed to have access, and they needed to have input, whether it was for care needs or decision making. We've worked with families to advocate for change and for improvements, both immediate and in the future. We successfully held off the virus for 6 weeks from Villa Colombo, but eventually one staff tested positive. That brought us to the action that we had where we tested every single resident and every staff member. That's 400 residents and almost 600 staff. Prior to any directive being given by the ministry, we took this on ourselves and we did it in-house. And we did find 9 positive staff and 9 positive residents who were all asymptomatic, which likely saved us from a worse outcome that we've had. Sadly, one of these residents did become symptomatic and passed away on May 2nd, but we were able to have his family present with him at the bedside for 3 days via FaceTime until he passed away peacefully. So his entire family was there with him virtually. What we've learned that nurses are proactive, not just at the bedside, but in our leadership positions. We've learned that listening to families has helped us tremendously. We let them lead the way. And if you provide the right information, but also be firm and stand your ground, you have to stand your ground to protect your residents and your staff, no matter what the guidelines say. Don't wait for directives to come out. Don't be afraid to use your professional judgment. We're now actively lobbying with the support of family to retest every resident and every staff member at Villa Colombo, and the families have become our voice for change. In the video, in the slide that you're looking at right now, this was from a parade of appreciation that happened on Friday here at Villa Colombo that was put together by our family council. There were close to 100 cars that came by along with emergency personnel. And it was quite an event, and the staff were very moved. So we know that the families do trust us with the care of their loved one. Thank you.
It's beautiful. Each one of you, amazing, just amazing, amazing presentations, huh? Just inspiring. I'm glad that we are taping and many others will be able to see it. It's just very good. I know I can say more, so go for it, Susan. Just take it over.
Thank you so much. And now I'd like to welcome Irene to go ahead and speak, please.
Thank you very much, Doris and Susan, and thank you for inviting me here tonight to speak to you just for a few minutes before I introduce the video that you're going to see. So when I reflect on what seems like a century, but really only a few weeks, I focus on some key themes, I think, that have come forward. And I'm hoping that they resonate with the rest of the panel as they have presented. So I think what we talk a lot about is the resiliency of those people, nurses and all health care providers, as we have taken on courageously and in a resilient way the changes that are coming at us moment to moment, it seems like, and having that strength to kind of find the spirit and the energy to come to work every day. And so I think resilience has been a key theme for us. The person-centered agenda, person and family-centered care, we were fortunate to join the OHT, the BPSO OHT, about 6 months ago. And we started our journey last fall, even into January, and that seems like so long ago now. And we started working with our anchor partners, and I know tonight that Kathleen Foley is with us from South Riverdale Health Center. We started as a group of healthcare providers looking at our strengths and potential areas of work together under the auspices of person and family-centered care. Well, COVID hit before we could really complete our gap analysis, but this opportunity has really made us think about what it means to be person and family centered. And so what I would like to share with you tonight is a practice, or I will call it a best practice. And this practice came to us many, many, many years ago when we were part of a professional practice consortium called the CPM Consortium. And when some of us, and I know some of you are on the line tonight, there's not a lot of us left here from that era, but when we went to one of those very large conferences, we heard a very poignant story from a chief nursing executive in California who lost her husband in a car accident. He was running, he had left the house to take a run, and he was struck by a vehicle and taken as a John Doe to one of the local hospitals. And so it was hours before she actually realized and was notified that her husband was at the hospital. And so she joined him there. What came out of this very tragic story is a tool called My Story. And she became dedicated to the mission of ensuring that her husband's story would be known by everyone who would enter his room, so that she could feel at peace with leaving, knowing that people would know him more than his medical diagnosis. And so fast forward, we have tried to bring this tool forward in a number of different times, different episodes. You'll see it in 2 different formats. So I'm hoping either Olivia or Susan, there you go. We created it in 2 formats because when we recently took it to our patient experience panel, some people really resonated with an open source kind of document where they could freelance their information. And other people liked it in this format that you see it, where it prompted them to provide a little more detail or prompts about what was important to me, for you to know about me when I was in the hospital. So during our COVID, many changes, we realized that it was important for us to provide that person-centered care, aside from the video conferencing and the iPads and all of our people who are able to facilitate that kind of connection. We also had the opportunity to transfer a number of our long-stay alternate level of care patients to an organization called Atrium at Q Beach Retirement Home in order to build capacity within our acute care hospital. So when we were working at transferring these individuals from our unit here with people who knew them very well to an organization that was unknown to them, But fortunate for these people, these patients, they were brought into the care of nurses that were employed by VHA. And these nurses were redeployed from roles where they were looking after children with medically complex conditions. And so when they were put in this setting to look after people, long-stay ALC patients, the first thing they said was, tell me their story. And so it gave us the greatest opportunity for our staff at Michael Garron to provide them with the stories of these 18 residents. And so I'm hoping that you can also show the tool that has it completed. Okay, so this is a picture of a new employee with us who just started. Her name is Batki, and she is a patient and family education specialist with us. But what she did was she facilitated these stories being documented with photos by calling family members and asking them to provide information, plus adding in the conversations that she had with our staff. She was able to provide or create these fantastic posters that now sit at the bedsides of each of those residents. So whenever anyone goes into those rooms, they're able to connect. And a fabulous story that I heard today when I talked to one of the managers responsible for the area, she talked about Mr. O. And Mr. O had the opportunity to take a glimpse at his poster, and he looked at it and got the biggest smile on his face when he saw his grandson, who was a fire cadet. He looked at it and he said, I know him. And it was just so heartwarming to see that they had connected with him in a way that they just couldn't do without these posters. And so I'm really proud of the work that we're doing here at Michael Garron Hospital to connect with people at the heart at a time where probably, I don't know, I don't think we've ever seen times like this, and I hope we never do again. But what has come out of this is great innovation. And I see the opportunity for innovations like this to take off even more. So with that, I will tell you about the video that you're going to see. And so we had the opportunity, our quality department actually wanted to find a way to contribute back to the organization, to recognize in some shape, way, or form all the great heroes, and the heroes not just within the hospital, but all across our network. And what they did was they reached out to community leaders like Doris and gave them a very short time to send in small video clips. And we were able to create this video in recognition of the many heroes in our healthcare system today. So with that, I will pass it over to you to play the video.
Who's a hero to me? All of the Michael Garron Hospital staff and physicians are heroes. A hero is someone who's courageous. A hero is noble. A hero does the right thing all the time, even when no one is looking. Someone whose actions inspire us. Someone who responds in a crisis.
So for me, a hero is someone who prioritizes doing the right thing. People who put the needs of the patients and the community above their own.
A hero to me is someone that shows courage in the face of adversity while doing something to help people.
Heroes work in partnership. Heroes collaborate with one another. Heroes are part of teams. Heroes build communities.
You have heroes who work in the kitchen. You have heroes who are doing the nursing, who are sweeping the floors, who are making the beds.
A hero rises to the occasion in the face of adversity. They meet opposition with optimism, and they put the collective interest ahead of the self-interest.
A hero, in the end, is someone who works selflessly on behalf of others, who puts in that sacrifice, and that perfectly describes your work in the course of this pandemic.
A hero gives us hope to be able to see the good and to bring the best out in humanity.
There are many things I'm proud of in how we have responded to COVID. We've prepared our hospital to receive COVID patients. We've trained our staff to be able to respond. We've protected our facility from COVID through things like screening, and our community is prepared and helping us through things like the cloth mask campaign and the PPE drive. There's so many moments of pride and examples of pride that we have across Michael Garrett Hospital. We are crushing COVID.
On behalf of the Toronto Police Service, I want to give a big shout out and a salute to all members of the Michael Garrett Hospital, from healthcare care workers to each and every member that are continuously providing professional, dedicated, and compassionate service to our community members.
Everything you're doing is so very appreciated by all of us in the East. You are going above and beyond. You are doing what is superhumanly possible to keep us all safe. You really are the heart of the East.
Thank you very much.
Thank you very much. Thank you.
Thank you.
Thank you again and again and again.
Thank you for all that you've done and all that you are. We couldn't do it without you.
Thank you to every healthcare professional working at Michael Garrett.
Thank you to all of the frontline healthcare workers.
Thank you all for being heroes.
I'm incredibly humble and proud to be part of this team.
Thank you for coming to work every day.
Thanks for trusting me and allowing me the opportunity to lead you through this.
Thank you.
Beautiful, beautiful. How did the nurse react to the video? Another health professional, Irene?
Oh, they loved it.
Yeah.
It's a great opportunity for people to tell stories from the heart. And I think we did hear 3 very poignant stories from 3 very different kinds of leaders, a nurse practitioner, a nurse manager, and a nurse in our intensive care unit today. And I think Minister Elliott was quite a thoughtful listener and provided very, I think, authentic reactions to their stories, which gives us hope.
I think that more than hope. For you, it's hope. For me, the door is open and we are rushing it. There is no more time to wait, you know? We had 2 chances with ECHO, guys, before we go into the clap, Susan. We had 2 chances of ECHO. 212, where a little happened. 214, where more happened, and Eric Hoskins put ECHO to very good use. And now is 220, where everything will happen. That's it. There is no more time to wait. And we need to move things before the second wave. I know you don't want to hear about that. And hopefully will be very localized, but we need to move all these pieces ASAP. So stay tuned tomorrow. I cannot think of any person that presented today that will not be thrilled with what you will read, all of you. And likely so will the other 240 people. Individuals that participated in the webinar and many others. And it's interesting because although I haven't given it to people external except of our board, of course, and some of our staff that were involved in writing it with me and with Matt Calloway and with Irma Jean now that is with us. And Brittany that drove it. The others that have not read it, I can tell you will love it too, including physicians, which really makes me very proud as a nurse for all of us, that nursing once again will bring solutions that the system desperately need, that many of you, including each one of the presenters tonight, from each perspective that you brought in one way or another, you mentioned things that you will read in the recommendations and in what needs to happen. So I can't wait till 10 a.m., even though I still need to finish the speaking notes for my Madam President and myself and Morgan. I can't wait till 10 a.m. because I can't wait for it to be out and to be put into action. Yeah.
Wonderful.
Your presentations were just inspiring at so many levels, inspiring from a authenticity perspective. All of you, Esther and Shirley and Irene and Kathleen, and I missed, sorry?
Tracy.
I'm trying to read you, but I thought it's Tracy. I have her in front of me here, but you're trying to tell me something, and I didn't know if I needed to rush. Okay, and Tracy.
I'm going to interrupt you a second, Doris, because I just need people to tell us we have to get ready for the cheer. So we have a few things to say before the cheer, but if you want to have your camera on, just put in the chat box that you want your camera on.
And we will promote you to panelists, so your picture will be in. So all of you, so Tracy and again, Kathleen and Shirley and Irene and Esther in the opposite direction now. Just so authentic and so both embedded with knowledge and embedded with the experience of the lived experience of what you went through. Tracy, I did not know that you guys had prepared even before because of the Italy aspect. I do need to share with you that I had at a very different level. You at the level of those that told your nurse that he was overreacting. I at my level that I had, including Ontario medical chief officer, trying to tell me I was overreacting, and it was because of the same though, Tracy, that I was in contact with the nurses in China because of our BPSO, and then it was, well, China is draconian was the answer, right? They do things in a draconian way. Then I spoke about Italy, and I was told that Italy was disorganized, and then I talked about Spain, and that's when the penny started to drop, because what can you say about Spain, you know, when they have a system that is very similar to ours. And if I have only one regret, even more than PPE and testing, because that you can excuse with we didn't have enough and it's a global shortage and all kinds of things, is that we started late. Despite of we started late, comparatively speaking, in Canada overall and in Ontario in particular, comparatively speaking, because we had the warning from China. We had a lot of time to prepare. And then we had the warning of Italy. And then we had the warning of Spain. And even after Spain, people still were saying, you go to the videos of those press conferences and others, low risk, low risk, low risk. It was never low risk. So it aches me because I think we could have lost less lives. It aches me that our voice of RNAO, even though was heard significantly more than during SARS, it was heard a lot, in fact. But I wish that nursing homes would have gotten the PPEs before anybody else, which is what we requested. And Kingston actually did that because we knew that people in nursing homes didn't have a chance, you know, they didn't have a chance otherwise. So it helps me so much, Tracy, hearing you to understand that you guys delayed significantly the outbreak in Villa Colombo because you actually did start before with all of that. So you kind of wonder and say, are we going to ever learn more? I know it's difficult because you're never pandemic ready. No one is pandemic ready, right? But in any case, fantastic presentations, amazing leaders, amazing presentations, each one of you so much. And Shirley, you are going to dance tomorrow. That's all I'm going to say. So will Kathleen.
So just a couple of things I would like to say before, so get your noisemakers out or your music makers out or your lungs ready. And a lot of people are coming to camera. I just wanted to say that every week we post these slides on our website. I have questions and answers from last week. So some of you, there aren't a ton of questions. It's more accolades and appreciation for the presentation today. But if there are outstanding questions, we'll post them on the slides for next week or bring them to Doris if they're more urgent. So those are resources and answers from last week. We're about to do our cheer, and one more plug, Doris.
The only thing, Susan, can we commit that we will have this presentation tomorrow or the day after Max on the website, because it's a phenomenal presentation to really celebrate Nursing Week.
Yeah, I think so. And just on the screen here is our campaign or to thank nurses. So please participate in this and submit your thanks that are publicly shared on social media. So now, Doris, I'm going to stop sharing, and I encourage people to put the gallery view on so that they can see as many people as possible.
And we are going to say together, let's practice so we make it perfect. After we bang, 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 when I do 3, we stop for a minute and we say, Happy Nursing Week, everybody. Happy Year of the Nurse. Go. 1, 2, 3. Happy Nursing Week. Happy Year of the Nurse. Here you go. Beautiful, beautiful, beautiful. Thank you, everybody. You are amazing leadership, all of you and each of you. Thank you to the presenters. It was fantastic. Kathleen, we adopt you as a nurse, including your cat.
Yeah, I know. He hears that noise and he thinks he's getting fed, Doris.
Esther, thank you so very much. Shirley, thank you as always. Thank you. And Irene, where is Irene? I don't see her.
She's still here. Yeah.
Irene, thank you. Amazing. And Tracy, fantastic, fantastic work. Really, all of you inspired us till no end. You just did a fantastic, fantastic job. Thank you so much. Thank you. People are lucky to have you as their leaders. And we are lucky to have you as our leaders. Thank you.
Where's your 1, 2, 3, Dora? Happy Nursing Week.
Happy Nursing Week.
Happy Nursing Week. Happy Nursing Week. Thank you.
Thank you so much, everyone. Have a great week.
Thanks for joining us. Bye, everybody. Thank you. Happy Nursing Week.
Bye-bye.
Bye.
Bye.
Happy Nursing Week.
Bye-bye. Oops, can't get it.